In the quest for looking younger, there are many options we can take. Today, board-certified surgeon in plastic and reconstructive surgery, Dr. Bruce Landon, is back to explain the different options of facial rejuvenation he offers. Good morning.
Good morning.
Good to see you.
Thank you so much for having me back.
We were chatting. We could talk about this subject, I think, for an hour because there's a lot that can be done nowadays. I think technology has improved so much over the years. This has got to be pretty exciting, I think, for you to be in this business at this time.
It's such a dynamic field, Carly. It's every month there's something new that comes out. All we have to do is read or watch Oprah.
Yep.
And we get a little bit of a window about what's changing in the world.
But it's interesting that when there's so many options, it can also be a little overwhelming for people, I think, to understand. Maybe they're looking at themselves and not feeling how they used to look, or maybe they see a picture of themselves and go, I just don't feel maybe how I feel inside. How are you able to help people and kind of steer them in the right direction? Where do you start?
Yeah, I think it's very daunting for people once they make the realization that there's certain features of the aging process that they no longer want to come to grips with, and they're looking for the information that somebody can impart to them as to what might be able to be done for that particular procedure. So I think the one thing that has to stand out in a patient office experience is they have to leave with the best education I or any other surgeon can give them about what options there are, because there are not just surgical options. There's a host of non-surgical options, and many times the two are very complementary. So people have to recognize that it's not just maybe I'm going to get a facelift procedure or I'm going to get some fillers, but perhaps the best solution to what they've come to see us about may be some combination of both, and that's what we spend so much time trying to get patients to realize.
And I'd imagine, we're working longer, we're living longer, we're dating, I think, at an older age as well. I mean, so when you see some of these patients that come in, kind of explain that process of, is that really how it starts? Is maybe they think, I'm not liking this particular area, or I'm not, because there's a million different ways you could put a plan of action together.
If we think back to 2007, when the recession really hit hard, we saw a very, and I'd say for lack of a better word, a very ugly trend in the office, and that was people coming to the office feeling non-competitive in the workplace by virtue of their age. We saw a tremendous number of men, usually a very small percentage of our facial practice, escalate to very large numbers. These were older men who felt like their jobs were in imminent jeopardy of being taken over by a young, more youthful-looking individual.
I think there's still some of that going on
and I
today.
think there's a lot of that going on. So I think that staying what they consider to be competitive and somebody that the office, or excuse me, their business would like to have them around has a huge impact on some people. And I think, look, there's a lot of people out there that feel like this was never in the cards for them. And then when we start to realize that we're not immune to the aging process, then there becomes a realization that maybe I am going to embark or dip my toes in the water and see what's available out there.
We have about a minute left, and I think when it does come to the aging process and kind of seeing what the procedures are and what you can do, there's a lot, again, to kind of look at. What do you want people to really understand when it comes to facial rejuvenation? So
I think that the most important things nowadays is that it's highly customizable. If you'd have come 20 years ago and you said, I want to look younger, you'd have gotten a facelift whether you needed it or not. Now things are very target specific. We've got tools in the arsenal to help with quality of skin issues, which are not addressed by a facelift. We've got volume related issues. We've got people that have too much volume in the face. We have people with too little. And then we also have typical suspension issues, the stuff that is in the neck and the jawline that wasn't there when I was 18. And each of these manifestations of aging are addressed by a different set of tools. So people have to understand that no, we can actually target the area of principal concern to you. You don't have to get everything. I think there's a fear that I'm going to come out having done and bit off much more than I wanted to.
Yeah, and they look at those pictures and they think, oh, I don't want to look like that of a certain celebrity or whatever, but the key is you know, hopefully you don't really notice anything has been done. Well, doctor, it's always such a pleasure to have you on the show, and we learned so much from you. We look forward to having you back. You have a great special offer for viewers this morning as well. You mentioned the facelift, still something pretty popular to get done, and a great offer on that right now for $1,000 off. But there's the number and the website to find out more. But again, doctor, we look forward to seeing you again soon.
Thank you very much for having me.